When patients push back on our recommendations, our instincts often fail us. We equivocate, over-explain, or avoid the topic altogether, and that usually makes things worse. There's a better way, a simple 4-step approach that helps you navigate the hardest conversations with more openness, more trust, and better outcomes. I'm Dr. Todd Wolynn, Executive Director of the Trusted Messenger Program and a pediatrician with over 30 years experience. I'm going to walk you through AIMS, an evidence-based communication approach that helps providers talk about vaccines in a way that builds trust and improves patient receptivity. AIMS is grounded in research, adapts to different settings and cultures, and is built for today's healthcare challenges. It works. More than 90% of AIMS trainees report feeling more confident, and over 60% say they've seen more patients accept vaccines. Let's dig in. AIMS stands for Announce, Inquire, Mirror, and Secure. These 4 steps offer a clear path for navigating conversations when patients are hesitant, unsure, or resistant. At its core, AIMS is about understanding and connecting. It's built on open dialogue, active listening, and trust. It helps patients feel heard, understood, and supported, and it gives you room to explain your recommendation in a way that lowers tension and builds clarity. In short, it helps you respond to resistance without the fear of confrontation. Let's walk through each step. Step 1, announce. Start with a friendly, matter-of-fact, presumptive announcement of the vaccines due at today's visit. Something like this. Since we're headed into respiratory season, you should get your flu shot while you're here today. It's the best protection you can get. Or, today, Susie is due for her TDAP, her HPV, and meningitis vaccines. That's it. Most of the time, this tone and approach are all you need. Research shows a clear, confident recommendation from a trusted provider works more than 70% of the time. Yes, really. Most patients will follow your lead as long as you don't equivocate, because your patients take their cues from you. But when we anticipate pushback, we soften our language and use what's called a participatory approach. It sounds something like this. Flu season's coming. Would you like to get your flu vaccine? Do you hear the difference? Your patients do. It's like asking, would you consider a course of antibiotics for your pneumonia? The contrast is clear. So are the results. A confident recommendation is often all it takes. If it isn't, that's your cue to move to step 2. Step 2, inquire. When a patient resists, we tend to do one of 2 things. 1, we try to scare them. 2, we might try and bury them in the data. We talk about ICUs and intubation, or we cite journal articles and efficacy stats. That might work for us, but it won't work for our patients. Research shows when patients are met with fear or dense data, their resistance hardens. We can't scare someone out of being scared, and we can't stats them out of it either. Why? Because people don't make decisions based on logic alone. They make them based on emotions, especially fear. Our job is to understand those fears, not to dismiss them. It's tempting to write off resistance as anti-science or conspiracy-driven, but most of the time it's not. It's just worry. That's a natural reaction to confusing or scary information. Even if their concerns aren't grounded in fact, their fear is real. They want reassurance, and often they've been misled. That's where we come in. Before we explain, we need to understand what's driving their concern. That's why we inquire. Something like this. Mrs. Jones, tell me what worries you about the flu vaccine. Or, Mr. Smith, you've been bringing Susie to see me for 11 years. I want to understand your concerns about the HPV vaccine. When you inquire, it does two things. One, it reinforces trust. Two, it tells you what actually matters to them. And here's the most important part. When the patient starts talking, you stop. Let them finish, even if they're misinformed, even if you're short on time. Interrupting someone when they're being vulnerable, it just breaks trust. Think you never interrupt? On average, providers interrupt within about 23 seconds. We all do it, but we can't do it here. Our silence sets up the next step. Step 3, mirror. Moving from inquire to mirror is critical. It builds trust and keeps the conversation open. The patient just took a really big risk by being honest with you. That's hard. Even harder if they think you might disagree or judge them. So even if you don't agree, they need to know you understand where they're coming from. They need to feel felt. Here's how you do that. So you've heard from family and friends that the flu vaccine doesn't work and might even cause the flu. Is that right? That's mirroring. Repeating what you heard in their words and asking if you got it right. It confirms understanding. It builds connection. You may go back and forth a bit to clarify, and that's fine. Stay with it until they feel understood. Now, they may be bracing for what usually comes next, fear, facts, or pushback. But instead, you offer something they don't expect. Empathy. Something like, that makes a lot of sense. If I heard that, I'd want to know more too. Or, I get it. If I thought that was true, I'd be scared also. These small moments shift the tone from defensive to collaborative. And no, you're not validating false claims. You're validating their emotional response. That deepens trust, and it sets you up for the next step. Step 4, secure. Now that your patient feels heard, they're more open to hearing from you, especially if you speak directly to what's worrying them. A good way to make that transition, ask permission. Would it be okay if I explained why I always get the flu vaccine myself? This small gesture signals respect. It tells the patient, I'm not here to steamroll you. I'm here to talk with you. It also personalizes your response, and that makes your message more relatable, especially when correcting misinformation. Flu shots contain a dead virus, so they can't cause infection, but they do help your body to make antibodies to protect you. Keep your responses brief, stick to the truth, and use positive phrasing whenever possible. So what if they still say no? It's not ideal, but it's okay. How you respond in that moment still matters. Thank you for sharing and listening. I understand if you're not ready. I recommend the vaccine because I care about your health. Secure isn't just about getting to yes. It's about protecting the relationship. Even if the outcome isn't what you hope, you've planted a seed and you've earned trust that you can build on. AIM simplifies complex science into everyday conversations that can increase vaccine acceptance and keep the door open for future dialogue, even with those who say no today. At worst, it strengthens your relationship with your patient. At best, it does that and helps them accept your vaccine recommendation. By following 4 simple steps, announce a confident recommendation. Inquire about the patient's concerns. Mirror those concerns to show you understand. And secure the trust that makes future care possible. You no longer have to dread these conversations. You're ready with a proven, flexible, evidence-based approach. AIM shows that small changes in how we talk can make a big difference in how our patients respond and in the care they choose to receive.